Good evening. Thank you for hearing my testimony. So my name is Christine Rayner, R-A-Y-N-E-R. So I live in South Providence, 2 miles from Fields Point. I'm a physician, and I'm here tonight to speak with you about the health risks of this proposed plant. One source I referred to that I found to be helpful is a letter from the Department of Health in Rhode Island addressed to FERC. I don't know if the CRMC has received anything directly from the Department of Health. I could submit this document just with the data that it contains, which is relevant.
If you'd like to submit it, you can.
I'm going to mark it as Exhibit 12.
So in brief, there are 3 significant health impacts related to the proposed LNG facility. First is the increase of air pollution in Providence. The energy will be required to liquefy this natural gas, as we heard, through the refrigeration process. That's going to increase emissions from somewhere to run this giant refrigeration facility, presumably power plants near the site. And I'm not clear about the increase in truck traffic. I read somewhere that there would be a more significant increase than what the witness from National Grid cited earlier, which was 1 truck per day. That still is an increase. That's an increase in air pollution in Fields Point. According to the Asthma and Allergy Foundation of America, Providence is already ranked 14th in the country in asthma rates, and we're definitely not the 14th largest city. When I looked at that data, clearly a large contributor is the excess air pollution we have in Providence already. And so I just wanted to mention, how pollution makes people sick. The type of pollution that comes from burning fossil fuels creates small particles and solvents that go into people's bloodstreams. It creates increased risk for heart disease and obviously respiratory conditions. The people who are most at risk for this pollution are children, the elderly, people who already have pre-existing heart and lung diseases, and people who are low income, who have more vulnerabilities, don't have such good access to health care. These are the people who live near the site of this proposed facility. We know some of the data that's in that letter, and that I've seen in other sites too, although I can't pick them out at just the moment from memory. The neighborhood within 1 mile of Fields Point is classed as an environmental justice community. 75% of the people who live there are classified as minorities. That puts them in the 91st percentile in our state. So there's a concentration of people of color in this neighborhood of the 91st percentile. 56% of the people who live within 1 mile of Fields Point are low income. That's in the 85th percentile of our state. This is a certain population of people already burdened with a lot of fossil fuel facilities. And these are people who are disproportionately at risk then for the health effects of the pollution that we'll see an increase of with this facility. The second health risk is this LNG facility is near Rhode Island Hospital. It's just across the street from it. Rhode Island Hospital is a level 1 trauma center. It's a very important medical center for Providence and the whole southeastern New England region. We heard some testimony about how this new plant will be safe in the event of storm surges and flooding. I would dispute from research I have done the water level rises that were cited of 2 feet by 2050. My understanding is it could be closer to 5 feet. So I think that's grossly underestimating what the sea level rise will be. I have concern that when we see more superstorms, it's going to damage the LNG facility. If it causes an explosion or a toxic leakage and Rhode Island Hospital has to close, what are we going to do? We need Rhode Island Hospital to function. The third health concern is that this new LNG facility, although we're being asked to comment on this very limited thing, it adds to the cumulative effects of all the fossil fuel facilities that we have that are causing climate change, and that in itself creates health risks. The average temperatures in Rhode Island have been increasing year by year, and just in the past few years, the numbers of days above 100 degrees has increased to the point that the Department of Health has revised its guidelines about heat safety. They pointed out, the death with heat stroke every year. They've now reclassified heat advisories in a more conservative way, defining them as 2 or more consecutive days of 95 degrees. And we're going to see more and more of these hot days with climate change. Also with climate change, our tick population can flourish, increasing rates of Lyme disease, which are already high in our region, and allowing the influx of even potentially deadlier tick-borne illnesses that we're starting to see.
Ms. Rayner, could you wrap up,
Absolutely.
please?
So in conclusion, it's clear that this facility poses immediate and long-term risk to Rhode Island residents through pollution, endangering an important hospital and contributing to climate change. We don't need more fossil fuel infrastructure in this neighborhood or anywhere else. Thank you.